coat of WBC and platelets. Same question was asked in the last exam. Remember, Buffy coat contains dash and dash. MCQ was there, no? Remember? Hey, bhul gaya? Huh? So, at the top there is plasma, the fluid part of our blood. Okay. So, what is this packed cell volume or hematocrit value? It is defined as the volume of the packed red cells in a given sample of blood. Volume of the given packed cell. Remember when we were studying about RBC indices, we were using the formula where there was PCV also. Remember? Okay, if you don't remember, go through the book and go through your previous lessons. PCV was there in the formula. Okay, it is expressed as the percentage of the total volume of the blood. We say na the PCV of a person is 45%, 40%, 46%. Okay, what is this? This means out of the entire, if we consider 100 ml of blood, it contains 46 ml of the volume of the RBCs are 46 ml or 45 ml. Whatever is the hematocrit, it is the volume of the RBC. Getting it? RBC का volume है packed cell volume. How the packing is done? Packing the red cell is achieved by centrifuging a column of blood in a glass tube or a Wintrobe tube. Okay. See, this is the centrifuge machine. Have you heard of the term centrifugal force, centripetal force? Okay. The force that is pushing you outside, this is centrifugal. Pulling you inwards, it is centripetal. So, in order to standardize, suppose we have to standardize for how many time we are going to use the, for how much time we are going to use the centrifuge machine. What would be the RPM? RPM means revolutions per minute. How many times it will be taking the revolutions per minute. We need to standardize that. Okay. According to that standard only, the PCV is calculated. Suppose for us, our standard is 3000 RPM for 30 minutes. Okay, 3000 RPM means 3000 revolutions per minute for 30 minutes. After 30 minutes only, we are going to see the value of PCV. Okay, or hematocrit. Optimum speed, क्या बोला मैंने? 3000 RPM. Okay, radius is there only. This is fixed radius is there for per centrifuge machine, and optimum duration is for us 30 minutes. Okay. It is very simple, very accurate, and method of estimating the red blood cell mass is we can say either it is normal or abnormal. Okay, suppose the PCV of a patient has come down. What does it mean? What can it mean? Anemia, one thing, or the blood has been diluted. If the blood is diluted, that means it has more fluid compartment of the blood than the cell compartment. Okay. So, if the blood is diluted, like in case of pregnancy, there is hemodilution. Okay, then you will have the decreased PCV. If a person has anemia, he or she will have decreased PCV. Similarly, if his blood cell are increased, like in polycythemia, then what will happen? PCV will increase. Okay. Okay, we can, this clinical value is by knowing the PCV, we can say if the patient is anemic or polycythemic, okay, or normal. Okay, this is the pipettes that are used to draw the blood. This is a tube. This is this machine only when you are going to remove the lid. Okay, that is it. Okay, there are 16, 4, 4, 4, 4. There are 16 different this set of this tube. Okay, it has different set of tubes in which we are going to place our blood, the set of blood, and then it will be used for this centrifugation. Okay, this is the centrifuge machine. Okay, it looks like that. Okay, it has come like that now. Okay, whatever I have said, it is written here. Blood mixed with anticoagulant. The blood should be mixed with anticoagulant. It can be double oxalate, it can be EDTA. Okay, whatever we are using now, EDTA mixed blood can be used. Okay, blood is mixed with anticoagulant first after drawing, and then it is placed in that centrifuge machine. Okay, but we need to take care of some simple things. Like when you're going to take blood directly, no? Suppose you're here, we take blood from the veins directly using a syringe. In the same syringe, you are not going to like push the blood into a tube, okay, or the whatever this penicillin tube bolte isko, you should not like force the blood out of like that. Why? Because if you force the blood through a needle ना, ऐसे force करेंगे ना उसको बाहर निकालने के लिए, then the blood may be hemolyzed. Okay, some blood may be, some cells may be hemolyzed. So for that, what we do after taking the blood, we remove the needle, then उससे आराम से करके we are going to fill the tube. Okay, if the blood is traveling through a narrow space at a very high speed, there is high chance of hemolysis. For that purpose, after drawing the blood, we are going to remove the needle and then by the syringe we are going to place the blood in a tube, a slow steady way, okay, so that blood does not, cells does not hemolyze. Okay, return is here, or it's 3000 rpm for 30 minutes. Okay, the similar picture is there. RBC पूरा red blood cell का अलग column होगा, बीच में क्या होगा, buffy coat contains WBCs and platelets, and at the superficial there would be plasma. Okay, everything happens here because of the effect of gravity or weight. Same thing here. Okay, after centrifugation, what will you see? So blood, na? Packed RBC at the bottom, buffy coat in between, and plasma layer at the top. Okay, so what are the methods of estimation of PCV? One is by the macro method using this Wintrobe tube, just what I have told now, taking the blood in a Wintrobe tube, okay, and then placing the tube inside that centrifuge machine, making the machine move 3000 revolutions per minute for 30 minutes. After that, let it settle, and you're going to see the 3 layers. Okay, 3 layers are this red blood cell layer, buffy coat layer, and the plasma layer. Okay. Another method is there, that is micro method using capillary tube. Similarly, we are going to take the blood in a capillary tube. We are going to place the capillary tube in a different centrifuge machine meant for that, and उसमें centrifuge करेंगे तो capillary tube में we are going to see the different layers. Same thing only in a capillary tube. Then there is automated analyzers, the last one. Okay, what are the anticoagulants used? EDTA, double oxalate. Okay. How do EDTA acts? Anyone? Yes, sir? How do EDTA act as anticoagulant? By chelating an ion. Which ion? Which ion is involved in the intrinsic pathway or extrinsic pathway? Calcium. By chelation of calcium, removing it from our blood, the blood then it prevents coagulation. Okay, that's how it acts as an anticoagulant. What is the principle? See, if you want to write, you can write it down. When this anticoagulated blood is centrifuged in a hematocrit tube at high speed, okay, the erythrocyte sediment at the bottom, this red cell column is called the hematocrit. Same thing in different language, I am telling you repeatedly. After centrifugation, due to the RBCs being heavy, will be settling down. Okay, this is called the PCV or hematocrit. Should I go to the next slide? Okay. What are the requirements here? The requirements of the specimen, that means the blood, Wintrobe tube where you are going to place the blood after taking it, then the pass-through pipette or a syringe जिसे तुम draw करोगे, either a pass-through pipette जो हमारे पास अभी नहीं है, I cannot show it, okay, but a syringe and a needle. I told you after drawing the blood you are going to throw away the needle and then you are going to take the blood inside a Wintrobe tube, okay, then the centrifuge machine. So the requirements, very easy, Then what is this Wintrobe tube? I have brought in a tube for you to see. See, this is how Wintrobe tube looks like. There would be graduations till 11. Okay, 10 till 10. Okay, suppose this is the graduations till 10. See, this is the Wintrobe tube. The entire length is 11 centimeter, but it is graduated till 10. Okay, suppose we have filled the Wintrobe's tube till 10 and the height of RBCs came to be 4.2. So what is the PCV? Huh? Yes? Yes sir? 4.2. Yes sir? I have taken blood till 10. There are till 10 there is graduations, right, in the tube. After centrifugation, from this 10 I can see the value of RBC, the column of RBC is 4.2. What is the PCV? 4.2%. Huh? 4.2% or 42%? 42%. Okay. Till out of 10 it is 4.2. Out of 100 it will be 42. Okay. Can I go next? Okay. What is the procedure here? You are going to level a Wintrobe's tube. If you are going to take this now for suppose I am taking blood from her, so I will give a tag. Okay, this is the blood of her. Okay, then fill the tube using the pipette or syringe. मैंने क्या बोला? We don't have the pipette here. We can use the syringe. Take a syringe. Take out the needle. See, they have written here needle of white bore to prevent mechanical breakdown of RBC. Take a white bore needle. White bore मतलब क्या है इसका? What I have told, if the blood is passing through a thin area, na, thin means narrow area, high chance of hemolysis. So we are going to take a needle that is wider bore. Okay, and while taking the same blood into a tube, we are going to remove the needle. Okay. Centrifuge for 30 minutes at 3000 RPM. And after the blood is centrifuged, there will be three different layers: RBC layer, buffy coat layer, and plasma layer. One important aspect of knowing the buffy coat layer is the malarial parasites are seen in the buffy coat layer. Okay, any disorders of WBCs you will find in buffy coat layer. Okay, any disorders of RBC you are going to see in the PCV or hematocrit, the RBC layers. Okay, if it is raised, if it is low, okay, you are going to see there. Any disorder of WBC you are going to see in the buffy coat layer. Okay, and one thing more, suppose I have considered that this area contains only WBC, but it is not possible, right? इसमें कुछ तो fluid होगा ना? Some amount of fluid will seep here. Suppose the RBC is settled down due to its weight. It has more mass, bigger cell, it is settling down. But in between the RBCs, there will be some fluid, right? So we are counting a higher PCV. There is more, there is some amount of fluid in between this RBC. So for that, for corrected or true hematocrit value is calculated by multiplying the same value by 0.98. Suppose I have found it came out to be 40. I will multiply it by 0.98. Then it will be the true hematocrit value. Why I have multiplied by 0.98? Because there is some amount of fluid in between this RBC layer. Okay. The plasma color. Okay, the plasma color and expected clinical conditions. In jaundice, it will be yellowish color. In lipemia means there is lipids. Lipemia means there is more amount of lipid in the blood. There would be milky color. Multiple myeloma is a cancerous conditions involving plasma cells. There would be cloudy in nature. Hemolysis means the RBCs are destroyed, there will be more amount of these pigments, RBC, heme will be there, it will be reddish in nature. Okay, just for your information. Okay, jaundice में yellow होगा, lipids are normally what? Milky in nature, milky होगा, and multiple myeloma, remember it's cloudy. It's a cancerous condition involving plasma cells, it will be cloudy in nature, the opposite will be cloudy in nature. Hemolysis, there will be reddish due to the presence of heme. Okay, after the breakdown of RBC, there will be heme in the plasma. Okay, there is other method except this Wintrobe's tube. So, other uses of this Wintrobe's tube. What is this? For ESR estimation. Remember your Prerana madam took a class there. ESR ka I took reticulocyte. For ESR also this Wintrobe tube is used. Where is the Wintrobe tube? One is here, another one. Okay. Everyone saw na the graduations. If it came to be like suppose 5, what will be the value of PCV? 6. 5.5. Easy. Okay. Okay. Some conditions where you will see the fall in hematocrit. Some conditions where you will see the fall in hematocrit means this value of RBC would be low. One condition you all know, anemia. Okay, anemia में कम होगा. Hemorrhage, if there is blood loss. If there is blood loss, the volume of this RBC will be low. Okay. Next, cirrhosis. Cirrhosis means a liver condition where albumin level is very low. And if albumin level is very low, the fluid comes to the periphery. Okay. Renal diseases, normal pregnancy. Okay. In normal pregnancy, what happens? I told you. There would be dilution of blood. So that's why the PCV value is less. In pregnancy, RBC value doesn't decrease. What happens? The blood becomes more diluted. Okay. Okay. Can I go to the next slide? What can be the cause of this increased hematocrit? The opposite one. If there is more of dehydration, means the plasma volume is decreased now. What will happen? If the plasma is decreased, the concentration of RBC will increase. Polycythemia, one thing. There is a condition where RBC count is more. Okay. Emphysema is a lung condition. You don't need to know what is this. In emphysema, in congenital heart disease, in physical exercise, there would be more amount of this increased hematocrit. Can anyone tell me why this increased exercise can cause increased hematocrit?
So that more
Easy, very easy. Come here, tell them.
as we need more oxygen, the RBCs will need more oxygen.
RBCs will need more oxygen.
It will increase.
RBCs will need more oxygen, the body will need more oxygen.
More oxygen.
So what will the RBC do? What will the body do? More RBCs. Why? Sir told last day also there would be hypoxia. Hypoxia, what induces hypoxia? Induces formation of more erythropoietin. Erythropoietin क्या करता है? Erythropoiesis. More amount of RBC production. This RBC will be carrying the oxygen, the increased demand of oxygen to the tissues. That's why in these wrestlers, in footballers who do their regular exercises, who have their more like physique, okay, they have higher amount of hematocrit. Okay, chalo. This is the normal range. Okay, specific range is written in the books. Okay, somewhere it's written 45%, somewhere it's written like 42 to 48% for men. For female, it's a bit lower. And I told in pregnancy it's bit lower. Why? Again I'm saying why? Hemodilution. Okay. Got it? काउंटिंग करो. Count your TLC. Everyone count your TLC. Focus and count. Hey, count. अरे वो बाहर जो है वो निकल रहा है. हाँ ये प्रेस यहाँ पे Yes, right. Okay, you have it on? Yes, you have it on. Huh? Let's look at this here. अरे वो बाहर जो है वो निकल रहा है. हाँ ये प्रेस यहाँ पे Yes, right. Okay, you have it on? Yes, you have it on. Huh? Let's look at this here.